Kia ora koutou katoa, welcome to today's briefing. There are 2 new cases of COVID-19 to report in managed isolation facilities in New Zealand today. The first case we're reporting today is a female teenager who arrived in New Zealand on the 13th of June and has been staying at the Novotel Auckland Airport, and she has been travelling with her siblings and her mother, who have all tested negative at this stage. Her only symptom was a runny nose. The teenager flew from Islamabad in Pakistan via Doha onto Melbourne and then into Auckland. The Doha and Melbourne legs are the same flights that one of the cases we reported last week was also on. The teenager has been interviewed thoroughly to make sure we can identify any other potential contacts and take appropriate action, recalling that everybody coming in on that flight from Melbourne into Auckland and then is going into managed isolation. So they are captured in our managed isolation facilities where they are all being tested twice. The second case we are reporting today is a man in his 30s who arrived in New Zealand from India on the 15th of June, and he has been staying at the Grand Millennium. He has not reported any symptoms at this point. The man's wife, who he has travelled with, has also not reported any symptoms and is being followed up further today. The flight the man arrived on was Air India 1316. This is the same flight from Delhi that one of yesterday's reported cases was also on. As we do with any positive cases, they have been transferred along with the people they are travelling with to the Jet Park quarantine facility. So with these additional 2 cases, our number of confirmed cases of COVID-19 is 1,163. We currently have 9 active cases, therefore, in New Zealand. One significant cluster remains open, the same one as has been previously, that is the St Margaret's one in Auckland. Yesterday, our labs completed 3,402 tests, and our total number of tests completed to date is 344,519. And on Saturday, just to give you an idea of the number of tests being undertaken in managed isolation facilities, there were 430 tests in the facilities across Auckland and 61 in the Christchurch facilities. So we can see that there is still a large amount of testing happening out in the community of people with symptoms as well. So nearly 3,000 of those 3,400 or so tests. We will update on the numbers done in, each day in managed isolation facilities. Now, just in terms of the picture between the 9th and 16th of June, the 16th being the day when we identified the 2 first cases, that women who had travelled from the UK last week. As you will recall, I requested that from the 9th of June, all people leaving managed isolation should have been tested, and so that I am assured that they are not a risk. And so under the current order, that means they have to be identified as low risk before they can leave. And I've asked since last Tuesday that I have made it clear that requires them to have a negative test. So subsequent to that, I had some information provided to me on Saturday that suggested that all who had left managed isolation since June the 9th had been tested for COVID-19 at the facility or subsequently. In fact, I had been given a number for the number of tests that had been taken in managed isolation facilities. So what I'm going to run you through now is a range of different numbers, but what we have done since last Tuesday to ensure that anyone who left a facility since the 9th of June has been or is being followed up. So from the 9th of June, there were 55 people who were granted exemptions, compassionate exemptions, to go into the community to self-isolate or for short-term visits, which is they leave the facility to visit someone in a hospice or a hospital. Of those 55, 54 have been followed up and have either been tested and returned a negative test. That is 50 of them. and then there are 4 who are children where it was deemed not appropriate to take a test for a range of reasons, but their family members have been tested and tested negative. Remembering that this is on top of the very strict requirements that people must comply with when they are out of managed isolation. There's 1 remaining person where there's been initial contact, and we're following up on the ground today to ensure that person has also had a test. If not, they'll be referred for testing. Now, for the 2 women who arrived back from the United Kingdom and were in the Novotel Ellerslie, everybody in the hotel at the time was tested and have returned a negative test. Likewise, we've followed up all the staff, 183 who had worked there during the period they were there, and all the health staff, which is over 50, have been tested and tested negative. They're the ones who would be most likely to be in closer interaction with the women. And of all the other staff, they've been followed up and referred for testing, bar 11 whom we're working with the hotel on still, who have not worked in this last period. There were also 190 people who had been guests at the hotel from when the women entered it on the 6th of June and the 13th when they departed. And of those 119, 176 have been contacted, referred for testing, and already we have negative results on 156 of those people as of yesterday. There is currently actually, it must be now up to 179 because there are now just 11 people being actively followed up on the ground to make sure that they are referred for testing as well. This is just part of our precautionary approach, and recalling that all of these people had completed their 14 days isolation in the hotel. And finally, there's extensive work underway to contact everyone, just as an extra precaution, who left a managed isolation facility between the 9th and the 16th to confirm that they have had a test, and if they haven't, to refer them for testing, recalling that all of those people will have done that 14-day in the isolation facility. All those people, we're well in the throes of contacting all those people just to check on them and make sure they have had a test, and we expect to have completed that by the end of today. And if anyone was in a managed isolation facility in that period and hasn't been contacted by the end of today to be checked on, there's a dedicated Healthline team to call if you haven't heard by the end of the day, and the phone number there is 09 302 0408. And finally, in terms of the other cases reported over the last few days, appropriate follow-up is underway for all those cases, including, of course, making sure that anyone who was on the flight or in the same isolation facility is being tested, and they're all being captured by our around day 3 and around day 12 testing that's now implemented through all the facilities. I'm open to questions.
Can I clarify with you? So the 1 woman who was in the Novotel in Auckland, what happens to those other people who are staying there now too? Do they have to start their 2-week isolation again?
You mean the case from today?
Yeah,
or
the case from today, or even more generally, if someone in the hotel gets it, do the others who've had contact with them have to start that 2 weeks again?
No, they don't, and that's why we have the really strict protocols in managed isolation. And you'll be aware from Air Commodore Webb has talked about the work we're doing just to audit those processes, or that he and his team are doing. And again, reflecting back that we have had 35 such cases even prior to Alert Level 1, and the way they are managed is exactly as happens now. So except that from when we had the cases last week, because they were the first 2 for a while, and because of the circumstances, we did this sort of lockdown of the facility just to be really certain and tested everybody. We will now be moving back to the routine protocols. And of course, the key thing here is, in addition to what measures were in place previously, we now know everybody is being tested at around day 3 and of course prior to exit. So no, other people in the hotel don't need to restart their isolation period.
When someone comes in, they then don't get tested until around that day 3 mark. Are the rules that they should stay in their room and not have any contact with other people until those 3 days? And if not, why not?
Well, they shouldn't have contact with other people anyway. I think that's the first thing. But this specific issue is one we are looking at. In fact, we started looking at that today as to whether actually there's a a much stricter regime applied at the start of that visit until people have had, at the start of the stay, until people have had that first test and it has returned negative before they may be allowed out. We're looking at that. We rely on the distancing and the other protocols, which if you've been to one of these facilities, you'll see they're really strictly adhered to.
Why is that just being looked at now?
Well, as I say, even in a setting where we didn't have the double testing happening, but the very strict protocols, that was serving us very well because they were reducing the risk of any transmission potentially occurring, as well as the daily symptoms checks. And I just want to reiterate that part of the reason we are finding people now that may not have symptoms or may be early in their infection is because we are doing the testing. And of course, we have got much more infection happening globally, and we're seeing people coming back from places like India and Pakistan, even the UK, where they have got wider infections.
What's happening with the guests at the Novotel that are either ready to leave today or tomorrow? Do they still get to leave?
From the original case or the one today?
Case, yeah.
From the latest case, yes. So again, we wanted to make sure that people are not delayed leaving. So we were I think last night it was reported the hotel had been locked down. That will be eased, and then people, of course, will be able to leave if it's their day 14 and they've had that negative test result returned. So we're putting a lot of effort in to making sure people get that test day 12, result day 13, so that they're all ready to go on day 14. I'm sure they don't want to stay a day longer than they might need to.
So you won't have to retest them again?
No, we won't have to retest them again. And of course, the public health unit does a pretty thorough interview with everybody, and we review CCTV footage as well from the last few days just to check that there's no potential risk that there could have been any contact.
Were today's 2 cases found through that day 3 testing, or why were they tested?
Yes, they were found through the day 3 testing, although one I think was around day 6. That was part of our catch-up. So it's sort of about day 3, and then we do the testing now about day 12, and we're trying to make sure that is, well, we're working to make sure that is day 12 so people aren't delayed leaving.
And so several of the cases over the past few days have been asymptomatic, at least to the point where they took their test. Does that raise concerns for you about this period prior to June 9, where there was no widespread testing in facilities and the possibility of an asymptomatic case having already come through? So
it does raise that possibility. So there are 2 things I would say here. First of all, and I was quite deliberate in the language I used today, that people are not reporting any symptoms as yet. So what we've found in a number of cases over the last week is that on very tight questioning, people may have had quite mild symptoms but didn't place any stock on them. And I think this again reinforces the importance of the testing. The second thing is the testing is still very much supplementary to the 14 days well-managed quarantine managed isolation period, because even the testing is not fail-safe. As we know, you can have false negatives with that. It's an extra assurance on top of the 14 days. And so I think and it's also serving a purpose of helping us identify, yes, how good is the symptom reporting we are getting, and also we're also looking here at, especially because these we've now seen more than one case on a couple of flights, what's happening at the point of departure in terms of screening and what else may need to be done there to strengthen that.
When you were running through all those numbers with us, there were a number of people who you hadn't contacted or either hadn't been tested. Why the delay in reaching those people or then getting tested? It's
not so much a delay as we started with the group that we felt was the first most important to start with, and those were the people who had compassionate exemptions, because they wouldn't have completed necessarily their 14 days, and some of them were out in the community. Then we moved to in addition to testing everybody in the facility and the staff and so on, to check that there wasn't some cross-infection happening in the facility. Then we moved to anyone who had left that facility. So we were working our way through on a sort of a reducing risk basis, and now we're looking at all the other managed isolation facilities where there haven't been any cases identified, and where we want to make sure everybody is followed up just to be certain, if they didn't have a test when they left, that they are referred for testing.
So of those 55 people who got the exemption, how many left, like the UK women, without having the proper tests?
I don't have that figure, but what I can tell you is about half of them were on, actually 24 of them had gone out back into a very careful and rigid self-isolation, so to be with a grieving relative or dying relative, or not closely with that person, but to be with their family. The others were on day type visit things, so not all of them were out there in the community. I don't have the figure for how many had been tested before they went out. I will aim to get that figure for you. One of the challenges we have had is that previously we didn't need to collect the NHI, the National Health Index number, on people in facilities, and so we're now working to do a match on date of birth and names onto our NHI database, which means we'll be able to link up with the testing and the date it was taken.
Because that is quite a key figure, isn't it? Because it shows how widespread the issue of not testing is. Is that accurate? So let's say half of the 55 people left the hotel or left their accommodation without being tested. That would be quite a significant.
Yes. No, so half of them went. Some of those, or many of those, in fact, all of them may have been tested, but I don't have that figure. I was just giving you a sense that only about half of them had gone into into a self-isolation scenario rather than being out on a day sort of leave.
Just over the last couple of days, today and tomorrow, we were told yesterday there's up to 900 people coming in from overseas to New Zealand. Could you just give us a little bit of information as to where they're going to be and if New Zealand even has room for such an influx?
I'm not the best person to talk about that. However, what I can say is we have spent much of the morning talking about this very issue and what the options are. And everybody agrees that the most important thing here is that the public health issues and the protection of the New Zealand population are paramount. So we have been talking about ways we can better manage the flow in, and there are a range of issues that need to be worked through there. And secondly, we want to make sure that any existing facilities or new facilities that are stood up can be managed safely, and we can make sure that they are that we're not getting infection or cross-infection.
Is there a likelihood that the Whangaproa airbase or the base could be used for any overflow?
It was raised in discussion. I don't think that, in fact, I don't think that's the issue so much as whether we may be able to use camper vans again, because in fact they worked very well when we did that first, as you'll recall, that first flight out of Wuhan. It seems a long time ago in February. But that could be a very useful way to stand up additional capacity. So these issues are under very active discussion right across government. So I'll just go.
The recent press releases have said that in regard to the UK here, there are a small amount of possible contacts to still be reached. How many is that small amount?
So that would be the number I gave. So of the 190 people who were in the hotel between the 9th and 16th, 7th, sorry, when they arrived. Okay, let me just go back. Between the 6th when they arrived and the 13th when they departed. So 190 people who were there contemporaneously and who had left and who may not have been tested. So that's the 190, and 179 of those have been contacted and referred for testing. We have negative results on 156 as of yesterday, and the other 11 are being followed up.
Right. You reached that goal of 80% of contacts within 4 days?
Within 2 days, yes. It's within 2 days,
and
yes.
In terms of the contact tracing system, the Allen and Clark report, where is it?
The Allen and Clark review was of the public health, of 3 public health units. It was a deep dive. Is that not been made available? I'll just check on. I'm very happy to release that. So we had Dr. Verril's review of the actual national contact tracing system, and then a follow-up review by her. I think those are public. And at the same time, we asked Allen and Clark to do a review. They did 3 public health units: Auckland Regional, Hawke's Bay, and Southern, and have done a report on that to complement the national one. So I'll follow that up.
What's been addressed there?
Well, the main issue there was ensuring that we are building the capacity, how to build the right capacity and capability locally in the public health units.
Are you confident that's happened?
It's well underway, yes, and I can give an update on that. I'll do that tomorrow. But one thing I would say that's become very apparent over the last week is the fact that we have put in this national contact tracing system where all the people being followed up can be on a single national database, and those other public health units can link to that and use it has been very helpful.
And just lastly, we're told that there's a household residents in Lower Hutt and Tony that are in self-isolation after possibly coming into contact with a COVID-19 case. Is that the case? Can you tell us anything more about that?
No, I don't have any details on that, but I'll check with the public health unit after this just to be sure.
It seemed earlier that you indicated that there are sort of two databases, one that has the information of people who are staying in these managed isolation facilities, and another that has the health information for people in terms of whether they've been tested. And because there was no NHI number in that first database, there was not actually a way to sort of cross-reference that. Is that what you were suggesting?
Yes, so that's right. And this is, of course, what we're trying to do now is match up not just the health data, but the sort of end-to-end journey for everyone through managed isolation. And it's especially important now. We want to make sure that the testing is undertaken, that the right people are, their names are put forward each third day and each 12th day to be tested, that we can get the teams on the ground and then record the negative test and report it before they go. So just up the back here, please.
There were 4 Kirikamapa that I had to close their doors last week due to the UK cases that were released. And with Rotorua being a new quarantine hub, how can you reassure that community, especially because it's a large multi-community, that they're safe, I suppose, that they won't be affected by that?
Kia ora, and thanks. I do want to reassure them of that, and just to again put this in perspective, we have had managed isolation for over 20,000 people now since the start of April across a range of facilities, and we are now putting on additional facilities. And as you've said, the ones in Rotorua stood up over the weekend. So we now have a lot of experience with how to run the facilities and the process very safely, and we have not seen a case from managed isolation then seed any community spread out, and it's doubly sure now because we've got the testing happening as well. So I can reassure people in Rotorua and elsewhere in the country, we have facilities in Christchurch, and as we look at the current capacity issues, we may need to stand up facilities in other parts of the country as well.
Just on that topic, what is the process for transferring someone so they go from bus from Auckland to Rotorua? Where do they stop on the way, and what are the processes around cleaning those facilities, etc.? Okay,
so the process was worked up very quickly for the transfer to Rotorua on Saturday, and as far as I'm aware, people were on the bus. There was a toilet stop in Waharoa, and then on they went, and that was very well managed to make sure it was all safe. The facility was then thoroughly cleaned, and then on they went to Rotorua. So
that was the only stop, and then is it special cleaning?
Yes.
Full PPE and all of that.
I don't know about whether it's full PPE in the buses, but there is a deep cleaning process that happens, and we've, of course, again, you'll recall when we first did the Wuhan evacuation flights, people were bussed from Auckland Airport through to Whangaparoa, so we've had experience right since then about doing this.
For people in Waharoa who are nervous about this, what assurance can you give to them, especially some of those communities who have already been through such a scare?
Oh, look, just that it's a really, we will be taking very, very strict precautions to make sure the facilities are well cleaned.
Can I just clarify, how many people who have left isolation from June 9th are yet to confirm they're negative for COVID?
So that's what we're busy working on at the moment. So I've given you the numbers of the people we can follow up, having started with the compassionate leave exemptions, the people from the Novotel, and working down, and then the balance, so people who were in other facilities, is the work that's underway, and everyone will have been contacted by the end of today. So we will know how many have had a test so far. Of all those that have been tested, we haven't had any positive tests. All the tests we are identifying now are people inside facilities.
And you mentioned last week that you couldn't force someone to take a test. Have you had anyone in quarantine refuse a test? And if so, how many?
Not that I am aware of. I will check that. Of course, if people do refuse that day 12 test, then they won't be able to reassure me that they are low risk and could be required to remain in the facility for a further 14 days. I haven't been notified of any of those as yet. Sorry,
just to clarify on an earlier number, and you might have said this again, if so, apologies. What's the number of people were able to leave isolation after completing their 14 days between June 9th and June 16th? Do you have a specific?
I don't have a specific number, and that's the one we're just making sure. I want to make sure I'm giving you the correct number there, and I will, once we have done that sweep of calls finished by the end of today, that everyone will have been able to be contacted. And this is partly because we use the numbers of people coming across the border, but many of those are air crew. And so I want to just be sure we're deducting the number of air crew, so we're matching that with the exit numbers coming out of the facilities.
Can I just ask you about the 24 days of no cases?
Hmm.
In light of what we've seen since this UK pair came out, is that accurate? Because it seems to be odd that we have, according to between 100 or 200 people coming home, even in level 4 lockdown a day. They're coming from countries that are COVID, have COVID massively. They come to the country, yet we seem to have 24 days of no cases. How did that happen?
Of the no cases?
Yeah.
Yes, because we did not find any cases. Remembering that anyone who came into managed isolation or through the border into managed isolation who was symptomatic, went to our quarantine facility, all were tested, and in fact, many hundred were tested. Of those, only 35 returned a positive COVID-19 test, so even amongst the symptomatic. The issue now is, of course, that because of the increase in the number of people that are coming and the scale, the acceleration of the pandemic offshore, that is why we are now seeing the cases. So I am confident, and also remembering we had the 14 days quarantine period in place.
Yeah. So are you going to start splitting the numbers so we have perhaps the community figure for New Zealand and then the figure at the border? Would that be a more sensible way of doing it?
Yes, yes. Well, I think in a way we sort of reset at the end of that 24 days, and all the cases so far are new imports. Unlike early on in the pandemic back in February and March, we are picking those all up in our managed isolation facilities or close to them at the border. So that's the difference here and now, and that's why I think having the testing ×2 plus the managed isolation is really a strong border defence. And as I say, we're increasingly looking at ways we can strengthen that. So looking at the boarding requirements at the other end, looking at what the expectations are on planes, on aircraft that are all flying in, to make sure that we're minimising any risk of spread if people are infected on the planes as well.
Are our sea borders being managed the same way as airports?
They're managed differently because different regulations, international regulations and legislation apply, but that is being actively considered actually by Cabinet today. So we're looking at ways we can make sure that is very strong as well.
So are people arriving by sea having to have a negative test before they come into the country most of the time?
No, they don't. There are requirements around the vessel having been at sea for 14 days if it's a vessel coming from offshore, or people aren't allowed shore leave. But as I say, there's Cabinet's actually considering that very issue today to make sure that we're watertight as well as airtight.
Have there been any suspected cases coming from?
No, there haven't been at this point. Yeah.
What was your advice to Cabinet around these maritime rules?
I would rather just wait for Cabinet to consider the advice, please, before divulging it here.
Just one last question I've got on the data and contact tracing. Yeah, formerly it was that the PHUs hadn't all taken up the National Contact Tracing Centre's software.
Yes.
How many PHUs remain in terms of needing to take that software up, and why haven't they taken it up?
So we've got 9 that have come onto the National Contact Tracing solution. There are 3, our 3 largest ones in Auckland, the Wellington region and Canterbury, and that is because they have extant systems. They are all able to, so they have their own systems already. They are now able to swap data in both directions with the national solution, but their systems also interface with their hospital systems as well. So we're looking at the sort of benefits of moving them onto the national contact tracing solution and not losing the functionality they already have by being able to link into their local lab or hospital systems.
Are you satisfied that that's effectively like them having adequate systems that can talk?
Yeah.
Both ways, is that effectively the same thing as having the central system?
It's not the same, but it's achieving the same functionality that we're looking for. And the local public health unit here, regional public health, which does have its own system and is looking after the 2 cases from the UK, has found it really, very useful to be able to share that information with our national contact tracing solution. So rather than them sending through a list of names or whatever, they can just upload the data in both directions of people who need to be followed up. Final question or
How
two?
busy,
Have you, oh, sorry, you go.
how busy are those PHUs right now with all of this, trying to get in contact with all these people who have hotels and so on and so forth? They were, according to Dr. Farrell's report, fairly overwhelmed in early
Yeah.
April, but how's that sort of improvement working out now?
So we're doing all the follow-up of people who have left hotels and so on is happening from our national close contact service here at the ministry, and we do that in conjunction with Healthline. So that's all directed out of here using the national contact tracing solution database and working closely with the public health units. What they are focused on at the moment is continuing to build up their capacity, if you'll recall, up to, so we can do up to 500 cases per day across the public health units or here in our national centre.
I just wanted to check if you'd had any update on the homeless man who went into the car plaza, whether that is the case.
Oh, I didn't, I'm sorry.
That's okay.
Yeah.
I'll keep following.
Okay, well, we better get on to that.
That's
Okay, thank you very much, everybody.